Hi, good morning Felix. My name is Alice May. I'm your invigilator for the OET speaking session on the 8th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Felix Carter.
And what is your candidate number, please?
My candidate number is 235891160.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find most rewarding about being a nurse?
For me, the rewards of nursing never stop coming. Every day, I'm learning and growing in ways I never dreamed possible. I feel so good when I see my patients improve, and when they hold the hands of family members, providing emotional support in times of tragedy. Helping people feels better than anything else I've ever done, and I get paid for it. It's the most amazing career I could imagine for myself.
What's your strongest skill as a nurse?
My strongest skill is patient education. It can soften fears and improve outcomes. One patient was unable to reduce his blood pressure following a heart attack. I was tasked with helping educate him about diet and exercise. I sourced some video case studies about patients just like him who had changed their routines. 3 months later, he wrote me a letter. His blood pressure and lipid profile were all down into a normal range.
How do you deal with the stress of nursing?
Dealing with stress is one of the most important parts of being a nurse. As a CN in an Alzheimer's care ward, I saw lots of patients without hope. Joining the Alzheimer's Association forum helped. It gave me ways to manage my stress, and showed me strategies to give emotional support to patients and their families. Support groups are my go-to for managing my stress.
What's the hardest thing about being a nurse?
For me, the hardest thing about nursing is the physical side. Being on my feet for an entire 12-hour shift, working night shifts, and lifting patients take a toll. I take weekly yoga classes, and do CrossFit for stamina and endurance. The stronger I am physical, the better I can deal with whatever nursing throws my way.
How do you respond when your friends ask for your diagnosis outside of the clinical setting?
I have faced these types of situations many times. I have a family friend who would ask me about symptoms he was having and what I thought he should do. I told him clearly that I could not give him a diagnosis outside of the clinic where I worked. He finally made an appointment to see the doctor there. It is always the best practice to treat patients in a holistic, professional manner, so we have all the right information to do what is best for them.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Felix Carter, one of the nurses working in this department. Can you please tell me your full name for the record?
Good morning, nurse. My full name is Alice May.
Thank you, Alice. Please confirm the reason for your visit.
Yes, nurse, I am here to attend an appointment for the information about chemotherapy.
All right. How do you feel about starting chemotherapy?
Nurse, I am feeling really worried about having chemotherapy, because this is my first time.
Alice, I can imagine the situation you are going through. Try not to worry about it. Just think, this is a treatment procedure, and you will be all right afterwards, leading a normal life.
I am trying to realize that, nurse.
That's good. Well, Alice, before proceeding further, tell me, what do you know about chemotherapy?
The doctor told me, the aim of chemotherapy is to reduce the risk of cancer, returning after my bowel operation. This is what I remember.
Okay. What about the duration of the treatment?
No, nurse, I don't remember anything else.
It's okay. I will explain it to you. Let's first discuss the course of treatment.
Okay, nurse.
Basically, chemotherapy is a 3-week cycle. That means, you might get a dose of chemotherapy on the first day, and then have 3 weeks of recovery time, before repeating the treatment. Each 3-week period is called a treatment cycle. Is it clear to you?
Yes, it is clear.
Several such cycles make up a course of chemotherapy. For your treatment, the total duration of the course is 24 weeks.
Oh, I see.
The chemotherapy drug can be administered at a day clinic. Well, Alice, may I know, have you read the patient information leaflets?
Yes, nurse, I have read the information on chemotherapy that you were given. But I am still unclear on what exactly will happen during the procedure.
It's all right. No worries. I will explain the treatment procedures to you.
That will be of great help, nurse.
All right. The treatment procedure begins with a blood test. Before each round of chemo, you will have a blood test called a complete blood count. This is done to get the levels of blood cells that can be affected by chemotherapy.
Oh, I see.
Afterwards, chemotherapy will be performed. The drug is infused into the vein, that is, intravenous delivery of chemotherapy drugs will be carried out for you.
Okay.
After chemotherapy, your doctor and treatment team will constantly monitor the effectiveness of your treatments. Moreover, you will be provided food and can drink after the chemo if you are not nauseous. You will be provided 6 short meals instead of 3 large meals, but in short intervals. The duration of the procedure may vary from 3 to 8 hours, depending on the situation.
Okay, I understand that.
Alice, I will make some recommendations to pass time during the procedure. Some of the methods you can adopt include reading books, and can use electronic devices such as music players or video players, to make you comfortable.
That sounds good, nurse. It's a good idea to bring something to pass the time. I hadn't thought about that.
Yes, Alice. Now, I would like to bring your attention to some of the common side effects of chemotherapy. After the procedure, you may experience nausea and fatigue. There is a lot amount of chance of losing your appetite and taste as well. Try not to bother about it too much. These will fade away sooner.
Okay, nurse. I know about the side effects. But I was concerned that they might be quite serious.
I appreciate your thoughtfulness. More importantly, reactions to chemotherapy are different for each individual. There are several reasons for the reactions. It depends on factors like the medication, duration of treatment, and level of your fitness and so on.
Oh, okay.
Don't panic hearing the same. I can reassure you that we will be here to help you. Assistance available for your condition includes medication for symptom relief, and helpline numbers to clarify concerns, or to get advice.
All right.
I would also like to remind you that you need to make transport arrangements after the sessions. It is because, after the procedure, you are not allowed to drive. May I know, is there anyone to accompany you back home?
Yes, nurse, my sister will be picking me up after the procedure.
That's perfect. Do I have to address any more concerns?
No, nurse. I am now feeling more informed and prepared for my first session of chemotherapy.
That's great. I wish you all the very best, Alice.
Thank you, nurse. That is the end of your OHE speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.